Good day, guys! I hope you are in a wonderful situation there while watching this recorded reporting at the comfort of your homes. I am Sacil Angelique Jaromay, the leader of Group 1, and together with my group members, we will tackle the first part of the topic in Module 10, which is the urine specimen collection. And at this point, we will talk about the proper collection and preparation of urine specimen for laboratory testing. As we all know, blood is not just the only specimen that is tested, as there are also other specimens that are being used for diagnosing the condition of patients. Now, what would be the learning outcomes for this lesson? At the end of the topic, the students shall be able to identify correctly the different types of urine specimens for laboratory testing and discuss methodically the collection and preparation for the urine specimens. Let's start first with knowing this urine specimen. Urine is the most commonly used non-blood specimen for analysis. It consists of physical component which includes the color, the consistency, and volume of urine specimen collected. Also, the chemical components, which include diagnosis for the presence of glucose, blood, nitrite, ammonia, and other chemical components. And lastly, the microscopic component wherein we check the presence of abnormal, normal, and pathologic crystals. We also check the presence of epithelial cells, urinary casts, bacteria, or any parasites that can be found in the urine sediments. For urinalysis of urine, we prefer the first morning urine specimen, and chain of custody must be established, this time for drug and alcohol testing. And if the specimen cannot be processed within 1 hour, it should be refrigerated. Because class, the bacteria could possibly grow and could affect the results. Therefore, we must refrigerate the sample to retard the growth of bacteria until the test is performed.
Now let's discuss the different types of urine specimen. Alright, so first is the random specimen. This type of specimen can be collected at any time of the day, and it is the most common type of specimen collected for tests to be performed on. Random specimens are used primarily for routine urinalysis. Next is the first morning specimen. So this type of sample is collected upon rising from sleep in the morning. It is the most concentrated and is the preferred specimen for pregnancy testing, bacterial cultures, and microscopic examinations. The third one is the 24-hour specimen. This type of urine specimen is collected under a strict time regimen in order to detect certain solutes because of journal variations. Patients are provided with a special container with preservatives. It is used for quantitative and qualitative analysis of substances. Next is the catheterized specimen. So a catheterized sample is obtained from the sampling port of the catheter bag. It is usually collected for bacterial culture, and it is collected in patients who are unable to void, babies, or bedridden patients. Another type of urine specimen is the midstream clean catch. So this type of specimen is the best alternative for the catheter specimen. It is done by discarding the first few portions of the urine and collecting the rest into the sterile container. This urine specimen is ideal for urine cultures. Lastly is the suprapubic aspiration. This type of sample is collected by obtaining a urine sample using a needle inserted into the bladder in the suprapubic region, typically to obtain an uncontaminated urine sample for bacterial cultures and cytological examination. Next, let's proceed to the procedure for urine specimen collection. For the random specimen, patients should be provided with a disposable urine container and directed to the bathroom facility. And before urinating, patients should wash and dry their hands thoroughly. And make sure to clean the genital area prior to voiding. The patient should collect a midstream specimen in the container and fill the container to half full. Then after the collection, make sure to label the specimen. So this type of specimen is routinely used for urinalysis and may not be used for a culture and sensitivity.
The first morning specimen. So the first morning specimen is referred to as a sample that is collected the first time the patient urinates in the morning. So these are the steps to collect the first morning specimen. So first, the patient is given a cup to take home. Second, the patient is going to collect a sample of urine the first time he or she urinates in the morning. It is preferred that you collect a specimen first thing in the morning because the first morning urination is more concentrated and likely to yield the best results. And lastly, return the specimen to the laboratory within 2 hours of collection or refrigerate. The patient must deliver the container with the entire specimen to the lab as soon as possible. If you expect a delay, refrigerate the specimen to retard growth of bacteria that could affect test results. The specimen should, however, be delivered to the lab within 2 hours. The timed specimen. The timed specimen is referred to as a biologic specimen obtained at a certain time of day or at a certain interval after another event. Usually 24-hour urine collection. A 24-hour urine collection is done by collecting your urine in a special container over a full 24-hour period. The container must be kept cool until the urine is returned to the lab. Patients are provided with large containers with preservatives. It is important to provide the patient with a specimen container with preservatives in order to prevent the patient's use of a container from home that might harbor contaminants and affect the test results.
Catheterized sample. This sample is collected under sterile conditions by passing a sterile hollow tube through the urethra into the bladder. The most commonly requested test on a catheterized sample is bacterial culture. This type of sample is collected on a patient unable to void, babies, or bedridden patients. Kung iisipin, hindi komportable ang umihi kapag may catheter, lalo na pag yung pasyente ay may UTI or urinary tract infection. This causes pain to the patient, however, isa talaga sa main functions ng catheter ay ang tulong magpalabas ng fluids galing sa katawan at ginagamit nito para masukat ng maayos ang ihi ng pasyente. There are series of steps to follow in performing catheterization. First, the area around the opening of the urethra should be thoroughly washed with antiseptic solution to prevent the risk of possible infections. Next, the tube is inserted in the urethra. And lastly, the catheter can be removed after the urine drains into the sterile container.
The next procedure is midstream clean catch. The midstream clean catch samples are used for urine cultures. Patients with orders of a urine culture and sensitivity are given the proper midstream urine collection kit and the appropriate instruction sheets. Patients are provided with sterile containers and antiseptic materials for cleansing the genitalia before collecting the specimen, since there may be some bacteria present in the genitalia that can contaminate the sample and may eventually lead to inaccurate results. Therefore, mild antiseptic towelettes are recommended. The procedures for collecting a clean catch sample may vary slightly between men and women and are described on the following slides.
Urine specimen collection for females for midstream clean catch specimen. Ang pagkuha ng sample galing sa ihi ay isa sa mga pinakamadaling kunin na sample dahil hindi na ito kailangang kunin mismo sa loob ng katawan ng pasyente. Least invasive. Malagang kunin ang proseso ng clean catch upang magkaroon ng insaktong resulta galing sa hindi kontaminadong sample. This instruction may vary slightly with different manufacturers. First, remove the lid from the container without touching the inside of the container or lid. Hold the skin fold apart and wipe or cleanse from the front to the back 3 times on either side of the urinary opening with the antiseptic towelette, using a clean one for each side. Bring the urine container into the stream of urine and collect an adequate amount of urine. Do not touch the inside of the container or allow the container to touch the genital area. Once 3/4 full, finish voiding into the toilet and cover the sample with the lid. Lastly, label the container with the name and time of collection and place in the specified area or hand in the phlebotomist for labeling. Bring the specimen to the lab within 1 hour of collection and store refrigerated for up to 24 hours.
And for the urine specimen collection in males, the following directions must be carefully observed and followed. The first thing you need to do is wash your hands. Next, remove the lid from the sterile container without touching the inside or the lid of the container, and cleanse the tip of the penis with an antiseptic towelette and let dry. Retract the foreskin if uncircumcised while urinating. Bring the sterile urine container into the stream of urine and collect an adequate amount of urine. Do not touch the inside of the container or allow the container to touch the genital area. Once 3/4 full, finish voiding into the toilet and cover the sample with the lid touching only the outside part of the container to avoid any contamination. Lastly, label the specimen container with the name and time of the collection and place in the specified area or hand it to the phlebotomist for labeling. And bring the specimen to the lab within 1 hour of collection or store refrigerated for up to 24 hours.
Another type of urine specimen collection is suprapubic sample. Suprapubic collection is a procedure to obtain uncontaminated urine from the urinary bladder. This sample is collected by external introduction of a needle through the abdomen into the bladder. Moreover, it is typically used as a method to collect urine in child less than 2 years of age who is not yet toilet trained in an effort to diagnose a urinary tract infection. Such reason is because suprapubic aspiration is used when a sample must be completely free of extraneous contamination, particularly in infants or children. This sample can be used for bacterial cultures and cytological examination. Since it is most often used in children, a 22-gauge needle attached to a 5 ml syringe is inserted into the site perpendicular to the abdominal wall, typically pointing 10 degrees in female and 20 degrees in male, caudally from the true vertical because the abdominal wall in children slopes down to the symphysis pubis.
During the process of urine preservation, there is the matter of contamination and microbial growth if the transportation of the sample analysis is delayed. To avoid this problem, the urine sample should be refrigerated by putting it in a sealed plastic bag and storing it in the refrigerator at around 5 degrees Celsius for routine urinalysis. However, with this, the sample should not be kept longer than 24 hours. Another solution would be to add chemical preservatives because it has the ability to keep bacterial population stable for up to 24 hours. These chemical preservatives include boric acid, hydrochloric acid, acetic acid, and oxalic acid.
Let's move forward to urine specimen testing. There are 2 types of urine specimen testing, and one of these is what we call urine dipstick. This is a test of urine using a special reagent strips that is dipped into a sample of urine. It is sometimes called rapid urine test because the results is immediately available. It is used to determine pathological changes in a patient's urine in standard urinalysis. The chemical strips change color if certain substances are present or if their levels are above typical levels. The strips must be stored in a dry place area at a temperature between 2 degrees Celsius and 30 degrees Celsius, because there is a possibility that the reagent's reactivity will be altered if the strips will be exposed to light. Before using your strips, it is important to check if they have expired or discoloration. And if any of this occurs, do not use the strips. Always run a control sample when opening a new supply. Follow the manufacturer's directions for accurate results and always note when you open the strips container so that you will be able to determine when it will expire. A strips container expires 6 months after the bottle is opened.
Now let's move on to culture testing. This test is used for midstream clean catch samples, so patients with orders for urine culture are given the proper midstream urine collection. This urine culture is a test that can detect bacteria in the urine that can cause an infection. For the process involving culture testing, the patients are provided with a sterile sample container for urine collection in order for the culture test to be accurate. In this test, the sample should not be kept longer than 1 hour because if it is kept longer than that, the bacteria in the sample may multiply and could affect the test result. If this happens, or if there is a delay in the testing, the sample must be refrigerated to preserve the sample culture accurately.
So that ends our discussion for today. Thank you very much for listening. Always remember, guys, according to Theodore Roosevelt, believe you can and you are halfway there.